Okay, so the second part of the brief, sorry about that, it cut out of time. The assignment, as I was mentioning before, is a separate piece of work which you have to pass with a mark of 40%, and it's marked out of 30. Word limit 3,000 words. You should not exceed that by more than 10%, otherwise you will get a penalty. Pop it through the Turnitin on the Blackboard site if you're worried at all about unintentionally plagiarising anything. So again, really plagiarism in the assignments just very much about making sure that you put in inverted commas where there are any quotes that you're taking directly, and just being really clear about that and just not copying great big chunks of it. Sometimes that can happen inadvertently over a period of time, and it will match it to the journal article that you've got it from. So if you're not sure, if perhaps because you've been doing this module for a year, you've been collecting evidence over a period of time and you can't quite remember where you've got that particular quote from and you're concerned about it, it might be worth just popping it through that system. So the referencing, use the Harvard system, which is the bracketed system with the names of the authors in the body of the text and the authors listed alphabetically in the correct order in the reference list at the back. So it's not the numbered system, it's the Eddy et al. With a date after it, and then in the back authors are listed by A, B, C, D, E as you're going down. So please don't use a combination. Some people use a combination of Harvard and Vancouver, so they'll use the correct referencing system in the main body of the text. So they might use Eddy et al, but then they'll number them in the reference list. So if you're not sure, do go back onto the Library Gateway, have a look. There's a really good referencing guide on there. Now, as I was saying before, with the learning outcome that is not the assignment, the top tip for the assignment itself is to again make sure that you answer the question that you've posed. So, for example, if you've negotiated if you've negotiated a learning outcome that is around you critically appraising the literature with reference to something specifically that you want to critique in context of your practice and come up with recommendations for practice, make sure that you do that. So make sure that you state what the problem is, critically evaluate the literature, and then make recommendations for practice. So keep checking back to that learning outcome that you've set in your assignment title, and make sure that as you're writing it, you're actually answering the questions. Because again, in my experience, that's where a lot of people fall down. What they do is they're interested in a particular topic area, and they think, do you know what, I'm going to go out and I'm going to research all about that, and they get loads and loads and loads of information, and they just pop it all on the page, but they're not answering the question. They're not actually thinking about how that applies to their practice. So it's being selective about what you're doing. If you've got a friend who will, proofread it for you. Proofreading is a brilliant thing. When you're writing, you get so close to it, you can't see what are obvious mistakes yourself. So if you can get a critical friend, either in the department or it doesn't even have to be somebody with radiotherapy experience, if you're wanting somebody just to see if there's any grammar or spelling errors on it, that kind of things. But if you've got a critical colleague who might read through it and see if it makes sense from their perspective, then again that all just helps you refine it and move you up the mark band. Okay, so the Webfolio itself is awarded 10 marks for the overall presentation, so that's the style and the format, making sure that it's appropriate. So again, if you've customised it yourself, in the past we've had people put images in. Again, be careful about images. Put a photo of yourself in there. They've changed the background on the Webfolio, they've altered the tabs and the layout, they've made it very personalised to them, and that's fine. What I would say is, if you do that, if you personalise your Webfolio and you don't go for the standard layout that was in the Webfolio you copied over, that is okay, but do make sure that you clearly direct the markers and the external examiner to where each of those learning outcomes lie. The Webfolio that we gave you to to copy over isn't the Bible. You don't have to stick by it. You can customize it. In fact, we do that really to help get you going. In the past, people didn't have a webfolio at all, and it really was up to you to create and present the evidence. So we've done that to help you, but you can alter it, you can customize it. But if you do that, just make sure on the introduction page you maybe put where the information is, and if you relabel the tabs down the side, be very clear about which learning outcome it matches to. Okay, so again, I've gone through in the previous presentation about writing in the first and the third person. So reflective pieces are okay to write in the first person. The more academic style, where you're discussing literature in context of practice, and certainly for the assignment, and I would imagine for a big part of the second individually negotiated learning outcome, you're going to be writing it as much more of an academic piece. Okay, so finally, what I want to say to you is it's really important with your webfolio to work smartly. Don't make this hard work for yourself. Throughout the whole of this module, we've given you little tasks to do each month. Like I said right at the start of the presentation, if you've been doing that, you've been taking on board the feedback, you've been amending and adjusting what you're going to put in the final submission as a result of that feedback, you're going to be there. So if you imagine these 4 tabs are the equivalent to the first 4 learning outcomes that we talked about, learning outcome 1, 2, 3 and 4, that are all met by your case studies. If you work smartly and you've got good case studies, you're going to be able to cross-reference to those in each of those learning outcome tabs and just put a narrative piece in each of those sections that link them together. What we're really looking for is that real critical approach. So this is master's level. We're wanting to see a critical review of what you're doing and how your practice is moving forward. The case studies, by the nature of them, will have parts in it that are descriptive. That's the nature of a case study. You need to describe what's happened to set the context. There isn't a problem with that. But in terms of marking it from an M-level point of view, that's not going to be the things that get you the marks. That's the kind of stuff that's like at undergraduate level in the early years. So, here we're looking for set the scene for us, tell us about that patient, but critically evaluate that. And if you've done that really well in each of your case studies, then for each of those first 4 learning outcomes, each of these little chaps here, you can pull all of those case studies together, selecting out 1 or 2 in each of those learning outcome tabs and just writing a narration about them. And what's important is that we want to be able to see how you've grown and developed in your clinical practice. So again, if you refer back to the initial presentation that I did, I talked about in the introduction, obviously setting the scene about yourself, the departments that you've worked in, where you're starting from, what your scope of practice is, and then putting in, interweaving throughout the webfolio bits about BENA, moving along the novice to expert practice continuum. So all the stuff we did right at the start of the module, thinking about where you started, what we want to see at the end, that final action plan is, where have you finished? So we can look at those 2 tabs and hopefully see that there's a difference in how you've grown and evolved. So now the time that you're going to be spending on tweaking this before the submission on the 4th of May is going to be more about making the webfolio itself seamless. Most of the work you've done as part of the formative activities, you've been doing it as you've been going through the module. This is just pulling it all together now into a really nice final piece of work. I really hope these 2 YouTube clips help you as you move towards the final submission date.